This is RegisteredNurseRN.com, and in this video we're going to discuss emergency room nurses, the job overview, the certification process, and the salary information. The responsibilities and duties of ER nurses include monitoring and attending to patients who are admitted to intensive care units and emergency rooms. It may be necessary to administer medications in these settings. These nurses may also have to help fellow physicians with tasks that are related to the medical care in the emergency room or ICU settings. And a basic summary of the ER's duties are that they evaluate, assess, plan, and implement care that is centered on patients in a nurse's unit. As far as the certification process, it's generally necessary to fulfill certain educational requirements before you become an ER nurse. In most cases, all you need is that you become a registered nurse, and what that means is you can go and get either an associate's degree or a bachelor's degree. The associate's degree is a 2-year program. The bachelor's degree is a 4-year program, and when you graduate from an accredited college or university, you can then sit for the NCLEX exam. That's the state board's test, and when you successfully pass that, then you will be given the license from your state, and you can legally practice as a registered nurse. In most cases, you just simply apply to a hospital and they'll hire you in, and if you're hired in the emergency room, for example, they will generally provide on-the-job training for you as long as you have the RN credential. And there's not really a lot of extra certifications that you usually have to get just to become an ER nurse. Now, one of the great things about becoming an ER nurse is that if you ever go for another position in nursing, they love to see that you've got that emergency room experience. So if you work in the emergency room, ICU, or whatever, they love to hire nurses who have that experience. So even if you don't like to work in the ER, that it may be a good idea just to work there for at least a year or two just to gain that experience, because it will open up a lot of doors for you in your career. You can also get the Master's of Science in Nursing, which is the master's degree, and at that level you will be able to probably move up the management position and have even more opportunities, and that generally takes about 2 to 3 years after you finish your undergraduate degree. As far as the salary for certified ER nurses is quite substantial, and the reason is, it's just such a high-paced, high-demand job. You deal with all kinds of, severe healthcare issues, people coming in from emergency situations, and because it does have a little bit more stress, you usually do get paid a higher wage than other areas of nursing. According to the Bureau of Labor Statistics, the median annual salary for emergency room nurses is about $52,000 a year, and with the rapid aging population and the shortage of qualified ER nurses, those wages may go up over time. And in general, the outlook is great for this type of nursing. ER nurses are always in high demand because, again, it being such a fast-paced, hectic environment, it can be sometimes hard to retain nurses. Some people love ER nursing, some people absolutely hate it. So it's just one of those areas that you either love or hate. And right now is a wonderful time to be a nurse. Nursing is one of the fastest growing occupations out of all the occupations according to the Bureau of Labor Statistics, and it's projected to remain that way for the next decade or so. So if you're interested in becoming a nurse, I'd like to invite you to stop by our site. It's RegisteredNurseRN.com, and there you'll find a lot of great articles and resources and tools so that you can learn about different nursing specialties. You can get information on how to apply to nursing school, and just lots of great resources. Thank you so much for watching, and have a great day.